snap it, stick it, prime it, squeeze it dance that we learned how to craft an ingenious line. Could we possibly forget uniform wearing requirements, care plans, test reviews, Sarah Bacon's goodies in the cafeteria after exams, pharmacology papers this year, making pharmacology PowerPoint presentations last year, Kosher and Herb, study groups, case studies, waiting in the hallway for exams to begin, pre-conferences, post-conferences, Bruner and Suter, that's a textbook, Student Nurses Association meetings, meetings with faculty advisors, or watching Jen Giverson get closer and closer to motherhood while we were studying maternity in class last year. How could we forget printing out reams of paper with PowerPoint slides for upcoming lectures? Ackley and Ludwig, yeah, that's another textbook. Online pharmacology tests, or Sharon McCullough's yeoman efforts to keep us all informed. And what about carpools with an entire clinical group piling into one car to save parking and or gas money? Or how about Hannah Roncallo's hairstyle or hair color of the week? Hannah, I swear your hair color changed 3 times and I worry if you're going to be Or Sue DeBarge warning us if we were to forget a basic nursing principle on an upcoming test during our first semester. I will hunt you down. Who among us who have had Linda Nevins for a clinical instructor could possibly forget her saying, "You're killing me"? Or many of us freezing in the icebox, sometimes known as room 207. Technical difficulties with the overhead projector. Frantically checking with classmates who had web access on their cell phones so we could get exam scores as soon as possible after the test. The big celebrations after our final exams each semester. Or counting the days, these last few weeks, to this very moment. As we head out into the real world of nursing, we have choices to encounter and decisions to make. Full-time or part-time, hospital or nursing home, night shift or evening shift or even rotating shifts, medical surgical unit or emergency department, stay near home or relocate. So many decisions to make, and one tiny little hurdle, I think it's called the NCLEX nursing licensing examination, still in our sights. But soon, even that hurdle will be in our rearview mirror. And we will encounter new and exciting nursing opportunities in which we will experience the gamut of emotions. From exhilaration to fear, from thrill to disappointment, all of the emotions one can imagine in any worthwhile profession. My classmates will recall that we had a written assignment early in our final semester called Nursing. Is it a profession? We were required to post our comments on this subject on the college's website called Blackboard after doing the appropriate research. Not surprisingly, all of us insisted that nursing is indeed a profession. Who could possibly dispute this? The reality is that many people, perhaps some of you in this room, do not view nursing as a profession, but rather as just a job, following the directions, doing what the doctors tell us to do. But if our experience over these past 2 years have taught us anything, and they surely have, we have learned that our jobs as nurses have a great deal more responsibility than merely following the doctor's orders. We have learned how to assess our patient's condition from head to toe, how to determine what action or actions is in the best interest of our patients, and how to advocate for our patients. Perhaps more importantly, we have learned how to learn, since we recognize that we are only at the beginning of our nursing careers, and we have a great deal to learn in the exciting world We have learned about some of the ethical dilemmas that nurses can face. Many of us will encounter these dilemmas and others we haven't even thought of yet during our nursing career. But each of us should be confident that we have been armed with the skills and the tools of learning necessary for success in the nursing profession by the educational experiences that we have enjoyed at Gateway these past 2 years. And let's not forget one other vital element in the success of the class of May 2010. I personally have continually marveled at you, yes, you, my classmates, at your practical skills and abilities to deal with the constant demands of jobs, whether they were full-time or part-time, with family illnesses, family losses, and family crises, the challenges of motherhood, of fatherhood, of relationships, and balance them all with the relentless demands of nursing school, to ask good questions, to seek to advance your skills and learning, and to be the best that you could be. You will recall that just prior to the start of each exam during our first semester, the faculty test proctor would remind us of all the work that each of us had done just to get into nursing school. A very lengthy and competitive process, and that we were the best and the brightest. Well, it worked. Here we are. We have made it this far. We will succeed because we are the best and the brightest. And we have received a great nursing education here at Gateway. We are ready to take that next step to being excellent professional registered nurses. Good luck to you all, my classmates, and thank you.